the type of the joint injections which we use mainly fall in two broad categories. The first category is the pain relieving joint injections. And the most common substances which we use for this is the steroids, which are also commonly known as cortisone injections. These are anti-inflammatory substances, and that can reduce the inflammation and therefore reduce the pain and swelling within the joint. The second category of the pain relieving injections are called the hyaluronic acid injections. Now, hyaluronic acid is a natural lubricant which is present in the joint. It is a clear jelly-like substance which can be put back into the joint, and that can also help to reduce the pain. There are more modern products which have come out in the market which actually combine the steroids with these viscoelastic substances, the hyaluronic acid injections. So these can be administered as a single shot injection, having both the components of steroids and hyaluronic acid. Moving on from there, there's another category of injections which we call as orthobiologic treatment. Now, these treatment methods, they actually harness the healing power of your own blood to treat the inflammatory conditions. And the two most common type of orthobiologic treatment which is used is the PRP injection, which is the platelet-rich plasma injection, and the end-stride treatment, which is also called the autologous protein solution. So in simple words, the end-stride is a product which is derived from your own body, and it's a concentrated solution containing good proteins, which when injected into your joint can recreate a healthy balance and a healthy environment, which can improve the health of your existing articular cartilage. Joint injections can be utilized for a variety of inflammatory conditions. The most common indication for use of these joint injection is osteoarthritis, rheumatoid arthritis, and gout. There are other soft tissue conditions like a tennis elbow, golfer's elbow, various kinds of tenosynovitis, which is inflammation of the lining of the tendons, and conditions like Morton's neuroma, which is the inflammation around the nerve, and the carpal tunnel syndrome. But the best thing is to speak to your surgeon, who can then assess you, take a detailed history, complete a physical examination, and also supplement this with various forms of imaging to actually define the condition, assess the extent of damage, and then create a very patient-specific treatment plan, which can include joint injections. Joint injections are usually a very safe treatment. They are part of your other conservative treatment plan. They are mostly carried out in the clinic in an outpatient setting. So by and large, patients don't need to be put to sleep. You can have different forms of anesthetic if you're scared of the needles, etc. The risk of injection in the scientific literature is about 1 in 1,000. If the steroid injection has been put in very close to the skin, it can cause some discoloration of the skin, especially in dark-skinned people. It can also reduce the fat if it is injected very close to the skin. In diabetic patients, it is known to alter the blood sugar levels, but that is only for a short duration. In rare conditions, we also see sometimes a flare-up of pain and swelling after these injections. But overall, patients find these injections as a very safe procedure. if the joint injections are used in the right context, they are extremely effective. And for that, really you need a proper assessment from your surgeon so that he can determine what kind of injection is going to be the best treatment option for yourself. And we can combine this with other forms of conservative treatment like physiotherapy, hydrotherapy, shockwave therapy, and all of this combined together can be an extremely safe and effective treatment plan, which can delay the need for any form of major surgery. The joint injection can last for approximately 3 months. In some cases, we see it lasting for 9 months to 12 months. Now, this is the data on injections like steroid or hyaluronic acid injections. For some specific orthobiologic treatment, like the end-stride treatment, the recent literature suggests that 70% of the patients who have undergone an end-stride treatment for arthritic knee joint pain, the pain relief has almost lasted for approximately 3 years after the injection. So really, these injections, if used for the right reason, in the correct patient at the right time, they can give you a long-lasting pain relief.